Welcome to Inspired Conversations. I'm your host, Diane. With me today is Dr. Judith Richmond. She's a breast surgeon, and she has an office in Lake Oswego, Oregon Breast Center. And thank you, Judith, Dr. Richmond, for coming today. This is really important stuff we're going to talk about, health benefits and people getting reimbursed.
Thank you. It's a pleasure to be here.
Yes, and so you are, not only are you a pioneer in medicine, especially in Oregon, you were one of the first doctors to do genetic testing for women for breast cancer or genetic mutations. Yeah. You also have some other innovative things that are at the forefront of. And now there is a little bill that hopefully will go to the legislation in February, Senate Bill 783?
Yes.
Okay,
correct.
And you are committed to helping get that passed.
Absolutely.
And I think that you have a very good reason for it, so I'm just going to ask you from the beginning, what experiences do you have with your patients when you're trying to get insurance to pay for procedures that are, like I mentioned before, are already approved?
Well, as a surgeon, every surgeon faces this when you need to do a procedure on a patient, whether they have cancer or a lump that needs to be removed, you have to get prior authorization from the insurance company. I actually had a patient say, I have cancer, what do you mean my insurance has to approve? Right. But it is the way it works. Mm-hmm. So oftentimes you go ahead, you get this authorization in a timely fashion, and then you go forth with a procedure, mm-hmm. and it's not approved.
After it was by the insurance company?
Correct. They have a backward adverse denial.
So how can that happen? I mean, so does this bill help? Would this bill, if it went before the Senate and it were passed, would that correct this very serious issue?
Well, that's my hope. The purpose is to make these things more transparent mm-hmm. to the patient so that they understand up front whether or not it's covered. When you go ahead and get your prior authorization, the patient gets an EOB, explanation of benefits, and it will say whether or not it's approved. The problem is this EOB doesn't always come in a timely fashion. So they may have it and it'll say, yes, this is approved, or they may have the procedure and then find out it wasn't approved. And the real issue is when you get a prior authorization, you get a number mm-hmm. saying this came from this insurance company on this day. It's good for a specific number of days. It's not good forever. Mm-hmm. Mm-hmm. You know, you'll get maybe a 30-day window to do a particular procedure. And at the bottom of that, the sheet I get from the insurance company says, this doesn't guarantee payment. So what's the purpose of this authorization?
So you're going on, well, you as a doctor, you're going on faith that the promise that they, or the hope that they would be reimbursed. The patient is literally putting not only their life on the line here, they're putting their whole financial future on the line, because if they have the procedure thinking it's going to be paid for by the insurance company and then it's not, this is the number one cause of bankruptcy in our country today.
It is, and everyone knows that last thing they sign before they go into the hospital says, yes, I'll be financially responsible, yes. which is where the bankruptcy comes from. And the real, it's interesting, what brought me to this point actually were things that didn't so much affect me, but I had two patients with cancer. One required radiation. Mm-hmm. The radiation oncologist treating her got prior approval, got almost to the end of her treatment, and the insurance company said, oh, yeah, she actually completed her treatment, and the insurance company said, not going to cover those last two treatments, totally unnecessary.
According to who?
And according to the insurance company, I mean, everyone, this is a planned procedure. People, you get, when you get radiation, you have what's called a planning session where you get a CT. The radiation oncologist determines based on the location of your cancer, based on your body habitus, what kind of treatment you're going to need and for how long. And there is a standard treatment, you know, and we don't need to get into the technicalities of this. And this was not outside that at all. And it was approved and not the last two, as though this patient just went and got radiation because she felt like it.
Are there physicians on insurance panels or in the insurance organization? I mean, what kind of a person, title, is making these kind of decisions? Are they bean counter accountants or?
It's a combination. There are physicians on the panel. You may or may not speak to another physician in your exact field when you're appealing one of these. You may talk to a nurse practitioner, or someone that maybe has a high school degree.
Wow. Yeah. So there is an appeal process. So let's say someone is in treatment and the insurance company had originally approved it, and then they decided to stop paying, which means they're either on the hook for paying it for themselves or stopping treatment, or they can appeal it. But is this a lengthy process?
It can be a lengthy process, but everyone has the right to appeal, and if you read the fine print that you get from your insurance company, it usually tells you, yes, you can appeal, and this is how you do it. What people don't know is when you make that appeal process, you need to make sure it's dated. You should send a copy to your treating physician, the insurance commissioner, and I think the attorney general, because the more of these that come in, the more they'll realize how often this is happening.
This is not that, this is, wow, I really am surprised. Even though I've heard anecdotal stories and I've had a few of my own with dental, not medical, things denied where they were first approved. But when we're talking about cancer and we're talking about life-saving treatment and the devastation of one oncology treatment can be hundreds of thousands of dollars. Is that right?
Well, yeah. Actually, $100,000 for chemotherapy is low because most cost much more than that. Standard radiation therapy is $20,000. A lot of people just don't have $120,000 in the bank just to write a check for. And once you start the treatment and you complete it, and then it's not paid for, it's bad enough, I feel, to face cancer. And then the slap is, oh, and by the way, the insurance you had, we're not paying for that. I think, I was absolutely incensed. One of my patients, the one that was actually 3/4 of the way through her chemotherapy, that was in excess of $300,000, was told, we're not covering this, it's experimental. Now, remember, there's always a treatment plan. That plan was submitted to the insurance company, and they approved it, and then retrospectively said, no, we're not going to do that. And she had to complete it. She filed for bankruptcy. She lost her home. She lost her job. And that pushed me over the edge. I said, that's enough.
That's just not right. I mean, in my opinion, until people stand up and start complaining about it or doing something, calling their legislators, calling the Department of Justice every time this happens, I mean, what else can you do? Well, you are working on this bill, and I would love people to get on board with it to see how far we can make this happen. So we're going to have on our screen, we're going to have some information and guidelines for people of where they can go and what they can do, because doing nothing is not working.
Doing nothing is not working. I don't anticipate in the current political climate that this will get better. I think people need to understand that whether or not you care about your neighbor who may have cancer, we will all suffer as a result.
And also, healthcare now is so insecure for insurance companies and all of us because of it being politicized. It's constantly being repealed and voted, and I don't mean constantly, but we had the Affordable Care Act. The part of it that I liked is that you can have a pre-existing condition and you aren't eliminated now. You're guilty by association because you've had something and you're not going to be treated for it again. That went away, but now the whole healthcare repeal is putting everyone in fear, and I'm sure the insurance companies are just trying to find a way to cover themselves.
Well, they're scrambling because when you have a state like that, they're not sure what their liability is going to be. And so just that in and of itself increases the premium. And I'm not sure exactly where we are at this moment in time, because we were going to repeal and replace, and now we're just going to repeal. But initially, the president had said he would try to keep the part in about pre-existing conditions. This is huge. If that goes away, there are millions of people. Look at all the people that just have diabetes now, which has quadrupled in the last 10 years. I mean, we can talk about surgeries, but there are things way bigger.
And I just think it's curious that the either most serious or most prescribed medications happen to be the most expensive. Isn't that curious? And so I want to ask you if you can make it simpler. Well, first let me say this. I just read that there was a Gallup poll done, and more people care about the healthcare issue than they care about the Russia investigation. So I know people care. And it's because they're afraid for their own health, the health of their loved ones, and their financial stability. So can you help us in easy to understand terms how our health care became so politicized?
Well, I think you get insurance companies and government in bed with each other. And a lot of this started initially when we started with Medicare. And when Medicare and Social Security came into existence, the average person was never expected to reach Social Security age. The average life expectancy was less than 65. It was more like 50-ish. And the same with Medicare. And I'll take some credit. We, the medical community, we've done a pretty good job, and people are living longer. More people are living longer. So this Medicare population has increased. This is what all the fuss was a couple of years ago. They talked about the SGR, sustained growth, because you can't say we're only going to pay this much for Medicare when the population, baby boomers, is increasing. People are living into their 70s and 80s. And
a lot of the terminal illnesses now are chronic diseases, which means there's ongoing health care costs.
Ongoing health care costs, exactly. Stage 4 breast cancer, 15 years ago, you weren't around very much. Stage 4 breast cancer now, 2, 3, 4, 5, 6 years out, some even longer. So yes, it's a lot of money. Medicine is big business. All these innovations that have allowed us to treat more complex disease, that have allowed us to pinpoint genes and pinpoint the kind of therapy we're going to give you based on the genetic makeup, to just kind of use a layman's terms, of this particular cancer. It's expensive. Genetic testing is expensive, but now we can say, we know that you have this, we know that your life expectancy in terms of getting breast cancer is 87%, so you don't have to wait until you have cancer. You can make a decision to have your breast removed, like Angelina Jolie,
Right.
prior to having breast cancer. That's great. It's while it costs to do this surgery, the cost of diagnosing a breast cancer, treating a breast cancer in terms of surgery, other adjuvant treatments like radiation oncology and chemotherapy, it's huge. It's huge.
And there's so many
saves
variables,
money.
so it doesn't mean you're going to go in for surgery, have your treatment, and you're cured. Some
right.
people get better, some people get better for a while. So yeah, there are a lot of variables in that for sure.
There are.
So, what would you say about the medical business model right now? How would you like to see, if life were perfect, how would you like to see it?
If life were perfect, I'd like to see a lot more prevention. I'd like to see my patients not stress over the finance. I understand that medicine costs money, but I think most people are employed and paying their employers, or altogether it's somewhere between $500 and $600 a month. So I think that's enough to cover those folks. And the insurance companies would still make a profit. If you look back over the last few years, even when our economy was tanked, who's at the top of the food chain making profits? Insurance companies. So if we just paid for the people that were insured based on their coverage, they would still make a profit. We wouldn't have patients in dire straits financially because of the cost. I've had in the last 5 years a 50% increase, and I just looked at these numbers, in women that chose mastectomies, bilateral mastectomies, having both their breasts removed, because they weren't sure what kind of coverage they were going to have in the future. They didn't know if it was going to be covered, so I'm just going to get rid of these. It's painful. It's painful to have someone.
It's just shocking
they're making
to me.
a choice based on finances. Is it unreasonable? No, because this is a sure bet.
Yeah.
You know, I don't know, I have cancer in this breast. Well, if I get cancer in this breast, which isn't as likely as a lot of people think, but if I do, what if I don't have insurance? I just want this one gone. I have sat down and really worked hard at saying, listen, the risk of that is really relatively low, and they can't face it. They're looking at their 20 or 30% copay for what they have right now today, and they can't take that risk. No one should be forced to make medical decisions based on finances as a patient.
Especially the way the system is set up, because it doesn't have to be. You know, we're going to take a short break, and when we come back, we're going to talk about what people can actually do to get involved.
Okay.
Okay, thank you, Dr. Richmond. You are watching Inspired Conversations. I'm Diane. We're here with Dr. Judith Richmond talking about your health care, and we want you to be proactive, and we're going to help you do it. We'll be right back. Dr. Judith Richmond stands out as a breast surgeon for her exemplary service and dedication to her patients, delivered with compassion and excellence. Dr. Judith Richmond is a tireless patient advocate who goes the extra mile, not only to provide the best care for her patients, but is a doctor who works diligently to help patients receive benefits within their insurance plan for completion of treatments ordered to ensure best possible health outcomes. Dr. Richmond is currently working on insurance reform for the state of Oregon to better serve her patients and all Oregon residents so that they receive their full share of health benefits without interruption of important and necessary medical treatments. Dr. Judith Richmond is a breast surgeon with the Oregon Breast Center in Lake Oswego, Oregon, and affiliated with Providence Medical Center. Welcome back to Inspired Conversations. We're here with Dr. Judith Richmond, breast cancer specialist, and we are going to recap this pre-authorization bill that we want to get on the books. We want it to go before the legislature, and we want to get it passed because tell what it will do for folks.
It'll make the insurance agreement more transparent to the consumer, which is the everyday citizen. It will have insurance companies be more accountable so that if something is authorized, it's authorized because we have to get these prior authorizations, and so there will be no more backup adverse determinations. Not like, gee, this was authorized, I did everything right. Why do I now have a bill for $100,000 for the medical treatment that I had that was approved that now suddenly is not approved?
This sounds essentially, this sounds very, very important. So we're going to tell folks, we're going to make it easy for them. We're going to have some links, email and call your legislators for the state of Oregon, because this thing will possibly be going up before, hopefully it will go up before the legislatures somewhere in 2017, September and November. Did I get that right?
That's right. That's right.
Okay.
And
So before then, which means right now, people need to start calling. And the more you call and the more you send emails, the more legislators are going to listen, because they know how they get put in office and how they stay in office.
Squeaky wheel gets oiled.
Because we vote. Okay, so that's what I want folks to do. Call to action is to make that phone call and make those and get those emails out to their legislators starting now, and so that this can really make a difference. Because everyone's health is going to be affected one way or the other. If it's not passed, we're going to have the same problem over again with people needing treatment, getting approved, then getting it pulled out from under them, and then having financial crisis. And who needs both a health crisis and a financial crisis?
Right, and the financial crisis is bankruptcy.
Yes.
Oftentimes. There are a few people that can do it, but we are government by the people.
Yes.
We can call our senators, we can call our representatives and say, we want this prior authorization bill voted on in a positive way. We want to see it happen.
Great.
It's very simple.
And I think I should emphasize that there's a lot of sniping and complaining about the federal government in terms of decision making or the decisions that they make, and the insurance bill being insurance healthcare being so politicized now. But we can do in our own community, Oregon, we can make a difference right here.
Well, that's exactly right. That's one of the things that the current administration has said is we're going to give things back to the state. Oregon has been a leader in many ways in terms of health care, and I think we should continue to lead because this is that important.
Great. Okay.
It really is.
Yes. I honestly, I don't know how you do it. You show up for surgery not knowing if insurance is going to pay for the procedure.
I do. But my role in life is to take care of patients. To this day, I have never sent a patient to collections that had cancer.
Wow.
You can't. I can't do it. And I think there are a lot of people out there like me, and you eat it, but I feel like I've done something better. It's bad enough you have to face cancer. I see the light go out of people's eyes every time I say, by the way, I have your biopsy result. It came back positive. And why should I add on top of that the financial stuff? So in my mind, I don't even think about that because I want to do what the right thing is to do.
And Dr. Richmond, you said there are a lot of people out there like you doing that, and I'm not sure I quite agree with that. I think that it's rare that you have that level of commitment.
I think there are quite a few, maybe not everybody, but I can tell you with regard to the prior authorization bill, there's not a physician out there that hasn't faced this. And you feel pain for your patients. They ask you what to do. They're afraid to come and see you. That's just, this is America. This is not a third world country. We can take care of everyone here.
Yes.
We really can. And this is just one way to make this happen.
And I applaud you for stepping up to the plate and taking this on as a project. You are a busy surgeon. I want to emphasize that fact. And it isn't like you have extra time to sit around and volunteer your time, but this is something that you are highly committed to for your patients and for other people as well. And you're going to be working with this, and we're going to be working with you to do what we can to help make this happen.
I'm in for the long haul. I am absolutely committed. And actually, before I came in, I was talking with a friend, and I said, that's the thing. We all know Hippocrates, and in his time, physicians were medicine providers. They were architects. They wanted to make sure that the patient got the right care, that they had the right environment. Hippocrates did all of those things. We, in the 21st century, have gotten so busy with our electronic medical records and all this paperwork that sometimes that gets lost, and I refuse. And yes, it takes its little toll, and I'm happy now because I've just come back from a little vacation and I'm refocused again.
Yeah.
And I will keep coming back to this until it's done.
Yeah, and what makes it doubly hard for physicians, physician's job is a lot harder than it ever used to be, because a lot of what what you have to do is dictated by the insurance company's agenda, which is, see a patient every 5 minutes, or, don't send them to a specialist. I mean, there's more incentive and motivation on the side of the insurance company to control your decision-making process and the way you care for people, and I know that is a hard line to walk.
Well, it is, but one of the pleasures I have is that I own my own business, and so if someone needs me for an hour or an hour and a half, they get me for an hour and a half. And actually, you know, I come here from a lot of places. I worked at Group Health, and the whole time I was there, the whole 5 years I was there, no one ever gave me a hard time because they knew they had this rating system, because people knew that when they came to me, they would get what they needed. And I'm sorry, every doctor doesn't have that luxury. Sometimes we are, like I've had patients come to me and say, well, my other doctor said they had so many minutes to address this problem, and if I had a second problem, I had to come back. Well, those are some of the constraints, but it doesn't have to be that way. We as physicians can rise, and there's talk about that nationally.
Yes, I know a lot of physicians are looking at different business models to run their business, having subscription for patients, you know, subscribing to their practice rather than concierge medicine. Yes. Thank you. So, you know, that's what I love about the American people. We are resilient, but it looks like we are at a time where we need to stand up and make our voices heard. And this is a great example of something that we should do. So, again, I applaud you. I thank you so much for spending your time to come to the studio and be interviewed, and we can't wait to start working with you on this. And so, folks, I want to impress upon you, this is Dr. Judith Richmond, Oregon Breast Center in Lake Oswego, Oregon, and it sounds like if I was in the audience and needed a doctor with, you know, a breast doctor, after what I just heard you say, you're the doctor. So I think your phone might be ringing. And I don't know if that's such a good thing, but I really thank you for all that you do.
Well, thank you. It's my pleasure, my passion. I actually believe it's what I was put on this earth to do. So I'll finish it.
It's your calling.
It's my calling.
Yes. Thank you so much for watching Inspired Conversations. I'm your host, Diane. Please see us again. We'll be around.